Thank you all for your patience, and I'm grateful for, first of all, I'm grateful for following Paolo, because now you are ready for a foreign accent. Before that, we had Dr. Yang, who has a perfect diction, and I said, oh my God, I have to talk after that? And then Paolo came and saved the day. I'm already 69, so the last Chiari case, or the last time I had the opportunity and the privilege of taking care of an individual with Chiari was like 7 years ago. And so I don't have any clinical based presentation. And my interest in the recent years has been understanding the origin of the meaning of Chiari. As you have seen, all the speakers today and yesterday, we had Chiari 0, Chiari 1, Chiari 1 at the 0.5. And if you see all the papers, I am as part of that confusion as all my colleagues, no? We always talk about decompression, but nobody told us what is the pressure, what is the evidence of the pressure. We are decompressing, yeah, but what is the pressure? And that led me, and I'm not going to talk about that, that led me to actually understand every form of literature, the medical literature particularly, because we have information, knowledge, and understanding. The three things together come. And in Chiari, when we had information, when we had knowledge, and when we had understanding, the historical aspect of such a triad. In those 2 days, we had fantastic speakers who expanded on the information and the knowledge and the understanding. To give you a historical example, just to explain better what I mean by each of one, we imagine Alexander Fleming. He came to his laboratory in London one Monday after Easter weekend, looked at some petri dish, and he found that some bacteria were being contained by the growth of a mold. That's information. So he published that information. I came to the lab and I found this thing. Wow. And that he published in 1929. In 1940, 11 years after, when the war was going, the Second World War, people needed to get an antibiotic for the wounded soldiers. Sulfas were not sufficient. 2 doctors in Oxford, not in London, in Oxford, Jane and Florey, decided, they say, there was a guy in London who wrote something. Let's find that paper. There wasn't any Google. They found the paper, they called the guy confirmed, and they synthesized penicillin. They came with the powder of penicillin. They determined the concentration at which penicillin has to be given to the individuals in order to be effective and not be damaging. And that's knowledge. So from information, we went to knowledge. And understanding, but the understanding of what penicillin is, was when they applied for the first human being. And they put the 2 and 2 together, and the first individual was a gentleman called Albert Alexander, a policeman, who had a skin infection. So we went from information to knowledge and to understanding in a period of 11 years. And and I don't want to bother you and take too much of your time here, for every medical discovery or for any medical advance, we had one process didn't follow the other one. And the three are necessary. And I'm quoting here Dr. John Oro. Yesterday talked about Ubuntu. And Ubuntu, in my understanding, is that in some areas, one individual plays one note, the other one another note, and the third another note, and the fourth and the fifth, and they all together come with a song. So you have information, you have knowledge, and you have understanding. How I advance this? Huh? The other one. I should have guessed what's the other one, because that's the So the there it is. Thank you. You see, I needed to point. I needed the information, but I didn't have the knowledge, and I couldn't understand what you were saying. So I was in a problem. So everything more or less it started with this monogram on Chiari. Is compiled in a book recently edited by Sean Tops, and he basically in 1895, so 127 years ago, had us here, and he gave information of the 4 types of Chiaris. And the information of the 4 types of Chiaris, even if it was detailed, and I will read of one case briefly, say case 9, a 35-year-old coachman's wife, internal clinic of Professor so-and-so, and according to the demented patient's recollection, which is quite unreliable, if I may add, a sack of potatoes fell on top of the previously healthy woman back on June 11, 1891, which caused her to fall down the stairs. And after the accident, she developed meningitis or some symptoms that they attributed to that. He did the autopsy, and he found that this lady was one of the cases with a Chiari 1, had a descendant of the cerebellar tonsils without the spina bifida, associated spina bifida. So okay, that's information in my point of view. Then, for example, we had Dr. Ehring, who was later became a respected psychiatrist here in Cincinnati, an academician. And Ehring, when he was in London at the Queen Square Hospital in 1937, he reports on the case of a young man who had a clinical picture that now will be familiar for all of us as being Chiari, and he did the histology of the tonsils, going along with Paolo, and he observed that the tonsils were abnormal, that the whole cerebellum was abnormal, and his report was of the abnormality of the cerebellum in patients who had this thing that Adams described before. And then we moved to 1978, and another paper. These are 2 authors from Sweden. I should have remembered the names, I apologize to them. And they say, okay, during the last 10 years, a growing number of Chiari type 1 malformation have been reported, in which the symptoms have been reported, 1, 2, 3, 4, 5, that's knowledge. So we have that information, and now we are building up knowledge. But when is that we build understanding according to what I understand by understanding? In this first case, that's why I put the initials of the 2 ladies, they were female patients, M.M. and A.B.J. in the title of this lecture. This is a paper with Walter Penfield, and it talks about a young, aged 29-year-old woman who was admitted to the Montreal Neurological Institute, had an operation at 3 of 8 for the repair of a spina bifida with meningocele in the thoracic region. You will see the picture soon. And then she had this operation when she was a child, and then since age of 16 begins to have difficulties in hearing. Then before admission she had noticed a dimness of vision, noticed the right eye seemed to water more than normally, and her friends told her that she had facial weakness. Fine. Facial weakness, and on the examination they found that she had ataxia, she had diminished reflexes. Again, clinical pictures familiar to all of you, either as a patient, as a relative of the patient, or the physician. And the patient was normally developed, alert and cooperative. There was a small lump over the upper dorsal region, that's the lump. You see, I have understanding now. I know how this thing works. So this is a lump over the dorsal region of the spine, 3 centimeters in diameter. General physical examination otherwise revealed nothing abnormal. And this is the patient just before the operation. The arrows indicates the site of operation of spina bifida. When you read the surgical procedure, it was done under local anesthesia. Local. It's not my accent, L-O-C-L, local. The patient was awake. And they sedated her part with ether and avertin. Avertin now is a drug used only for rodents in the laboratory. They did the surgical procedure. They did an incision, an arch incision on the occiput. They pulled the muscle down. And because they took her to the OR with the idea that she had a posterior fossa tumor. They were looking for a posterior fossa tumor. This is 1937, 40 years ago. Chiari wrote in German, something like that. But people knew because of Adams and Scoville, but they knew. They took her there. They opened the bone, start trimming up. And in the narrative by Dr. Penfield is fantastic. He says, we didn't find any tumor. We probed. There wasn't any tumor. And in one moment, Penfield says, wait a moment, what's that? And where the 2 tonsils descended. So he remembered the Chiari paper. He must have told to his assistant in the time, according to his narrative. I said, oh yeah, she had, this young lady had a cord, meningocele, and then he says, certainly that is pulling downwards. The cause of the Chiari is the traction from the scar from the meningocele. They closed the incision, and 2 months after, and the patient never woke up. She died. She died a month or 2 after. And Penfield says, what I think that happened is that because she had the traction and we relieve the pressure on the cerebellum or the adhesions, that created a disjunction on the brainstem and bulbar palsy, and that young lady died. But why I included here? In the same there's this is on his description. I think this is the first description that where a physician understood the disease and the patient. Because without anybody asking Penfield to include that, she said that she had lost her position as bookkeeper because tears that she could not wink away fell on her work. And that is a moment of understanding. That is a moment I'm not operating at a patient with facial palsy. I'm operating on at a patient who lost her job because the tears that she couldn't control botched her work, no? And I said, wow, great. And around that time, this was in this was presented on the American Association of Neuropathologists and is published in one of the American Journals of Neurology. It was presented in 1936, no? And at that time also, in 1937, Dr. Ehring, he presented that case of the young man that I told you, and the cerebellar problems and so on. But Ehring, although he became a psychiatrist, all his clinical description of the patient is a factual clinical description. It's a clinical description like, happened this at the cranial nerve, this nerve, this nerve, this nerve. And there is a lot of that. She lost her job because she couldn't prevent her tears from falling into the work she was doing, no? But then we actually came here. That the final straw, amazingly enough, was done here in Illinois by the predecessor of our own Konstantin Slavin, Dr. Busi. Dr. Busi here in Illinois at Konstantin's hospital was done the first surgical procedure in a Chiari patient who did not have spina bifida or hydrocephalus. But still, why I'm bringing her here as an understanding? And I trick it a little bit because the understanding is on the first paragraph. And I insist, those are sentences that they shouldn't be written there. I mean, that thing that Penfield writes, that extra thing from the bookkeeper wasn't necessary to the description of the surgery or whatever. And this 40-year-old woman, she also showed a series of clinical pictures familiar to all of you: facial, 7, 8, ataxia, gait, difficulties in walking, and she had a surgical procedure, and she was taken to surgery also with a diagnosis of a posterior fossa tumor. Paul Busi didn't think of Chiari. And they took her to surgery as a posterior fossa tumor, and this is the surgical procedure that they performed in this young woman looking for the a tumor that wasn't there. And two things. It's very similar to the surgical procedure that was very in favor, involved for many years for the Chiari, the massive decompression. Now we do a much less decompression because we know there is a danger for cerebellar slumping, right? But that procedure for the Chiari, and Bush immediately noticed, according to his paper, that the tonsils were descended. But he said, yeah, the tonsils are descended, but we are not going to close without we really prove that there's no tumor. And there wasn't any tumor. And they published this paper and the surgical technique. I had pictures of procedures done at UCLA by many of my predecessors, and it's almost identical prior to the moment that we started with this thing. Before showing you and finishing this presentation with the element of understanding of Dr. Busi, coincidentally, the surgical procedures was done in November 27, 1943. November 27, 1943 was the day that the first naval aviator recipient of the Medal of Honor was killed in the Pacific. He was a gentleman born in St. Louis, Missouri, and his name was Edward O'Hare. Sounds familiar, the name? The replica of his plane is in Terminal 2. So the day that Edward O'Hare was being killed in air combat in Japan, Busi was determining at Illinois the understanding that we have today of the Chiari type 1 surgical procedures. But this is the actual part that I omitted in the beginning. Where was Dr. Busi's understanding? And this is my last slide. And this is his understanding. She was perfectly well until August 1942, when after a day of unusual hard work, her legs gave her way and she slumped to the floor. That is understanding. Forget about the surgical procedure. And she survived. She also had the surgical procedure under local anesthesia. And she survived. She actually improved in that. So the process, the historical process of information, knowledge, and understanding is something that started in the 1895 or the 95 with Chiari, and was completed with Dr. Bussi here in Chicago, and coincidentally with Constantine is now the chair of that department and worth follower of Dr. Bussi. It was understood, okay, this is what ASAP is about. This is of being aware that you can lose your job because you have a facial palsy, because you are aware that your legs can give up. And fortunately, we still have many physicians who understand that after a day of unusual hard work, her legs gave away and she slumped to the floor. A completely unnecessary statement in the paper, but fundamental for our understanding of Chiari. Thank you. I'm done.